Two male members from the cast of Meet the Fockers have prostate problems. Can you guess who they are? If you've guessed Greg Focker, Ben Stiller, and Jack Burns, Robert De Niro, you are right. They both have prostate problems of the most severe kind. Both of these actors have been diagnosed with prostate cancer.
Next tonight to Ben Stiller's cancer battle, the actor revealing he was treated for prostate cancer 2 years ago at the age of 48. ABC's David Wright tonight on the medical test that Stiller believes saved his life.
I had prostate cancer a couple of years ago.
Today on the Howard Stern Show, actor Ben Stiller dropped a bombshell.
It just stops everything in your life when you get a diagnosis of cancer, because you can't plan for a movie, you can't because you don't know what's going to happen.
Today, we're going to look at their eyes and see what we can see in relation to their prostates. We'll look at what a prostate weakness looks like in Greg Focker and in Jack Burns. Remember where to look when you're looking for a prostate weakness? If you don't know how or where to look, I have uploaded a prostate video where I go through exactly how to spot a prostate weakness and the complexity surrounding it. In the right iris, we look at the 5 o'clock mark, and in the left iris, we look at the 7 o'clock mark. And as you can see, there are features or markings in Ben Stiller's eyes exactly at the 5 and 7 o'clock marks. First thing I want to mention is his iris color. Did you know that this is not Mr. Focker's real iris color? He's naturally got blue eyes, faded blue eyes. Just the color tone alone can give us an insight into a person's lymphatic system as a whole. This is Ben's real iris tone in the movie Meet the Parents. So we have established his true iris tone, which is a faded blue. It is well known that celebrities on red carpeted events will use color enhancing contacts. They do this in order to elevate their attractiveness. It is obviously very striking to have bright blue eyes compared to darker ones. Let's look at Ben's eye color in his 30s and now in his 50s. Do you notice the eye tone darkening? You can see that Ben that's in his 50s has a darker tone than in his 30s. Let's look at Ben Stiller's co-star in Something About Mary. Her eyes also appear darker. If this is accurate, it means that the body's lymph system is becoming stagnant. You can argue the point that there is different lighting and camera lights, but at these red carpeted events, the lighting on the stars are usually the best in the business. You be the judge. Please like, comment, share and subscribe to show your support for my channel. Follow along as I analyze eyes of famous people. Alright, so let's get back to Greg Focker. I mean Ben Stiller's prostate gland. So we can see here at the 7 o'clock mark a distinct colored mass. This mass in this area means that there is lymph stagnation, causing the prostate to be weak. The right iris has a similar feature. Right at the 5 o'clock mark, there is a thick mass there, indicating lymph from the lymphatic system struggles to drain at the prostate gland. Some people only have the weakness on the left and not on the right, or vice versa. Having a weakness in both eyes just strengthens the weakness. We can confirm here that we have a bona fide prostate weakness. Now, if we had met Ben 30 years earlier, we can give him this vital information and maybe he can do something about it. Let's go back in time, back to the past, and let Ben know about his future prostate gland weakness.
Hello?
G'day Ben, how you going?
Who is this?
Look, my name's Tony. I'm calling you from the future.
Wait, do I know you?
No, you don't know me. I'm calling you to warn you about your future prostate problem. In about 20 years time, you're going to develop some prostate issue because there's a double weakness in both of your eyes. Look, it's a long story, but I know how to read eyes and I've seen your eyes and they both show your prostate gland to be weak.
I don't believe it. Just from looking at my eyes.
Yes, from your eyes. I'm looking at your eyes right now. I'm comparing them from the 30-year-old you to the 50-year-old you, and all I'm seeing is a prostate weakness. That has manifested, mate. I'm telling you. So when the time comes, remember, PSA, prostate-specific antigen test. You'll save your life. This is no joke. Please, take this seriously, as again, it may save your life. Also, one last thing. Are you able to take a piss in a jar? I want to confirm if this is what happens with no sediment for 20 to 30 years. That's what happens when you ask someone to piss in a jar. It's important to have sediment in your urine. It means that your kidneys are functioning, allowing cellular waste to pass out of the body. Our old mate here, in our previous prostate video, who's had 3 prostate enlargements, he has 0 sediment. My father-in-law, who's in his 60s, he had a prostate resection. He also has zero sediment. This is what cellular waste looks like from kidneys that are functioning optimally. We should all be producing this kind of waste from our kidneys. If you're not, then cellular waste products are being held inside of the body, causing all sorts of issues from minor to major. Alright, now let's look at our old mate Robert De Niro. His eyes are fairly dark to begin with, so I'm going to up the brightness and contrast so we can see clearer at the 7 and 5 o'clock marks. Bingo! Here we have it, folks. Right iris has a thick white mass, with possibly a swollen lymph node, and on the left side, he's got a big fat swollen lymph node right at the 7 o'clock mark, indicating a prostate gland weakness. He's also got going a partial lymphatic rosary, which are the small white dots on the edges of the iris going from 7 o'clock to 9 o'clock. This location indicates he may be suffering from chronic back pain, all down his CT and L spine. Now have a look at the right side, 5 o'clock mark. What do you see? Mate, that is a huge white mass. I'll be surprised if his prostate isn't enlarged. Seeing lymph nodes in the iris tells me Robert has got blue eye genetics. You can't see the lymph nodes in a true brown eye. Remember, some people just have a weakness on one side and not the other. But if you have it in both eyes, it just strengthens the weakness. So Ben Stiller and Robert De Niro both have a few things in common. They both are amazing actors, both played together in one of my favourite movies, and both have markings in the 5 o'clock and 7 o'clock marks of their eyes, which confirms a bona fide prostate weakness.